Good evening and welcome to the January 11, 2021 Board of Health meeting. At this time, I'll call the meeting to order. We'll do a roll call and I'll call each person's first name. If you'll say your first and last name and then present at this time. So I don't see Courtney. Robert?
Robert here.
Mary Ann? Mary Ann, can you do it one more time? Or Mike's?
Yeah, I can hear you. Carrie Hampton here.
Alan Ferguson? Okay, Mr. Ferguson, are you there? Going down. We got the folks not here. Julie?
Julie May here.
Brian?
Ryan Snipes here.
Mac?
Max Sunny here.
Amy?
Amy Williams here.
I'm Marty Trotter, and I'm here. Let's try Alan.
There's no sound and no picture.
Put down there. Or where's your sound, like you would do for your
Here,
headset?
here.
Where's your like you would do for your headset?
No.
Maybe it's on your.
All right, guys, just be patient. We're trying to get everybody on board here.
You might have to put your headset on to get your sound because your computer may be looking for your headset. Is your headset plugged in?
I wasn't going to use it. Well, what's this password?
Go ahead and
Oh, what you need. I don't know.
which one? Mute his mic.
Password 2886.
We try it again. What should we do to help him? He's got sound. It's just the video's not.
You look at participants, they'll show if you're there.
I'm not sure.
I was there a minute ago.
Yeah, you're there. You're right there.
Why is it doing that?
No, he didn't.
I asked you about your camera because your camera may not be on.
Yeah, maybe so.
You may have to sign off again. But just go up there and leave the meeting and sign back in.
Right here.
Yeah. We can hear him talking to us.
Well, the next item is a welcome him, so. Yeah. We have a form.
Yes. Okay, we're moving down the agenda. We did the roll call. Hope Haywood has joined us. So Hope, you just say your first and last name and present.
Hope Haywood, present.
Okay, thank you. This time I'll turn it over to Susan Hayes for the election of the chair.
Good evening, Board of Health members. tonight we need to, we will accept nominations for Board of Health Chair. So the floor is open. Do I hear any nominations?
Your speaker.
This is Max Sunny. I would nominate Marty Trotter for chair.
I will second that nomination.
Are there any, is there any discussion about that or any other nominations someone
I
would
have
like
to
to
let
make?
you in. You've already done that, haven't you?
All in favor, state your name and
Got you muted.
confirmation.
They want you muted. But I would still mute myself. Can you get this off here?
Robert,
Robert Brown.
Are you able to start video? How do I answer that?
I can't hear you. You're being walked on.
okay. So we've got a motion for Marty Trotter in a second to be the board chair. So I'm going to ask each one of you to state your name, and we'll start with Dr. Brown and your affirmation if that's what you agree to. So
Okay.
Dr. Brown.
I, Robert Brown, say aye.
Mary?
Yes.
Thank you. Mary Ann Evans. Mary Ann, unmute yourself. Now. No. Dr. Hampton,
Yes. Carrie Hampton, aye.
Matt,
Max Sunny, aye.
Julie Mae,
Julie Mabe, aye.
Amy,
Amy Williams, I.
Alan, can you hear us? Dr. Snipes?
Aye.
Okay. Hope Haywood, excuse me, Hope, I forget
That's
your
all right.
name. All right, so Marty Trotter is our board chair for 2021. So I'm going to turn the meeting over to Marty.
Well, thank you, guys. Look forward to serving with you again, and certainly if there's anything I can do in this role, please reach out and let me know. Next on the agenda is the election of vice chair, and at this time, I'll open the floor for nominations for vice chair.
I nominate Dr. Robert Brown. Carrie Hampton.
I'll
Max
second
Sunny,
that.
second.
Ryan Snipes.
Okay, we have a motion and a second. Any discussion? Any additional nominations? Okay, hearing none, we'll go through the roll and I'll call your first name. If you'll signify by saying aye or nay. We'll start with Robert.
Robert Brown, aye.
Mary Ann,
Mary Ann Evans, aye.
Mr. Ferguson, Carrie,
Carrie Hampton, aye.
Hope,
Hope Haywood, aye.
Julie,
Julie Mabe, aye.
Ryan,
Ryan Snipes, aye.
Mac,
Max Sunny, aye.
Amy,
Amy Williams, I.
I'm Marty Trotter. Aye. So congratulations, Dr. Brown, on vice chair.
Thank you very much.
Next on the agenda is public comment period. Brooke, we don't have anybody that signed up. No one submitted an email to me, so we have no public comments at this time. In your package, you should have received the 2021 Board of Health meeting schedule. Is there any comments or conflicts that you see on those dates that were submitted to you? Brooke, you don't approve that, right? So with no conflicts being heard, then that'll be our schedule for this year. Certainly, we may have to adjust that if something were to come up, but put those on your calendar if you would, and that's the schedule that we'll follow for the 2021 year. Okay, next on the agenda is approval of the minutes for the November 9, 2020 Board of Health meeting. Do I hear a motion to approve those as presented?
I move to approve the minutes of the meeting as presented.
I have a motion from Robert Brown. Do I have a second?
Hope Haywood, second.
Hope Haywood, second. So we'll go back to the roll again and call your first name. Please signify by saying aye or no. Robert Brown,
Robert Brown, aye.
Mary Ann,
Mary Ann Evans, I.
Alan,
Aye.
Carrie,
Carrie Hampton, I.
Hope,
Hope Haywood, aye.
Julie,
Julie May, aye.
Brian,
Ryan Snipes, aye.
Mac,
Max Semi, aye.
Amy,
Amy Williams, I.
Marty Trotter, aye. Okay, moving on down the agenda. Next is Tara Aker, and she will share with us the Board of Health operating procedures.
Good evening, everybody. You should have received in your packet in the mail, the operating procedures for the Board of Health. The only revision was the date change. If you guys have had a chance to look over it, if there's any suggested changes, we can entertain those now. If not, we need to take steps to approve those for this year as they are.
So any discussion on or questions on the Board of Health operating procedures? Okay, hearing none, do I have a motion to approve the Board of Health operating procedures as presented?
Amy Williams, I make the motion to approve the,
Okay,
as written.
Okay,
I second the motion.
okay. So we'll go back to the roll and I'll call your first name again. Robert,
Robert Brown, aye.
Mary Ann,
Mary Ann Evans, I.
Alan,
Alan Ferguson, aye.
Carrie,
Carrie Hampton, I.
Hope,
Hope Haywood, aye.
Julie,
Julie May, aye.
Brian,
Ryan Snipes, aye.
Mac,
Max Semi, aye.
Amy,
Amy Williams, I.
Marty Trotter, aye. Thank you. Next will be the Board of Health manual updates, and Terry will help us with that as well.
Everybody received one of these manuals when you onboarded to the Board of Health. There's just some updates you guys need to switch out some outdated materials and replace them with updated materials. So one is just the cover, the book cover. It just is updated to include the new year. So it's going to be for January 1st, 2021. Our mission statement is the second document that needs to be switched out. And then there's an updated appointments term expiration dates, and that has contact information for our board members. There's an organizational chart for public health, Randolph County Public Health. And then the operating procedures that you just approved, once those are signed, you guys will get a copy of that in the mail to place in your board manual. Any questions about that?
Okay, thanks, Tara. Susan, we'll turn it back over to you. I think we've got our technical difficulties worked out at this point, so I'm going to have Susan introduce our new board member.
So, want to welcome Alan Ferguson. Alan was appointed by the Board of Commissioners in December to serve as a community member on the Board of Health. Alan, it has been a long time county resident of North Carolina, of Randolph County, and he lives in the Liberty area. We are excited to have him be a part of our board, and we welcome you, Alan, and look forward to working with you.
Thank you, Susan. I appreciate it. I'm unfortunately incompetent about getting my picture to show up there right now, but I finally did get the video. So I've got a backwards U2 cam showing, which is not really the way I look, but sorry you can't see me. I'm glad to be here. I've practiced law in Randolph and Guilford counties since 1983. And I hope somewhere along the way, after I learn all the good work you guys are doing, that I'll be of some help to the board.
Thank you so much. Okay. So next on the agenda is my job description, the job description of the health director. There were a couple of changes this year. They're very minor. One is that we put it on our new format. We had a change in our logo and our name to some degree. And so we had to put that job description on a new format. The other one is animal control changed from animal control to animal services. So we changed that phrasing in the job description. Otherwise, it remains the same. So I need to ask you to approve the job description.
So board members, if you recall, that's an annual requirement that we do each year, and Susan just outlined the updates. The main one being the logo and the going from Randolph County Health Department to, Randolph County Health Department to Randolph County Public Health, and also updating the department title for Randolph County Animal Services. So those were the changes that were made in the job description for the health director. At this time, do I hear a motion to approve the job description as presented?
I make a motion to approve the job description as presented. Robert Brown.
Have a motion, do I hear a second?
Ryan Snipes, I'll second.
Okay, second from Ryan. I'll go back to the roll. If you please signify by saying aye or no. Robert?
Robert Brown, aye.
Mary Ann?
Mary Ann Evans, I.
Alan?
Alan Ferguson, aye.
Carrie Hampton, I.
Hope?
Hope Haywood,
Julie?
Julie May, aye.
Ryan?
Ryan Snipes, aye. So going from control to services, does that mean the dog moves from the back of the truck to the cab? Just curious.
Yes.
Mac?
Max Semi, aye.
Amy?
Amy Williams, aye.
Marty Trotter, aye. Okay, and then the last agenda item we have is the health director's report from Susan.
So I'm going to start off and then we're going to end with Tara. I've asked her to help me with this report. So first, I want to update y'all about our opioid situation in Randolph County. I know before COVID, that's what we were talking about. And we haven't talked about that much in the last year. So in the last, what we are seeing is an increase in overdoses in Randolph County. And we have we had a little spike last week. There were like 4 overdoses in one day. So in 2019, all told, we had 663 overdoses, and 36 of those were fatal. That's in 2019. In 2020, we saw less overdoses, but we saw more fatal overdoses this past year. So instead of 36, which we saw in the previous year, in 2020, we had 53 individuals die from opioid overdose. So that is going in the wrong direction. So we are trying to watch that as much as we can amid all the other things we've got going on. But I did want to make you all aware of that. And right along with that increase, and I would say we've seen that increase in the last maybe 3 months, three or 4 months. We've also seen an increase in hepatitis A numbers. So for the year, for 2020, we had 35 positive hepatitis A cases. 100% of those were in individuals who use IV drugs. And so we know, we've got that issue going on. So Randolph County is not alone in that, but it is something we need to keep our eye on and try to find as many public health mitigation strategies as we can to interfere with that transmission. And the problem with this is these are people that they're hard to find because a lot of them are homeless. We know where they camp out. The other part of that is it's a capacity kind of thing. I've got all of our capacity focused on coronavirus. And so it is something that we're aware of, and we're looking at ways that we can intervene given the situation we're in. The other things I'll share with you is for the past 10 months, we've seen 9,339 total cases of coronavirus. In the last 14 days, we've had 1,586. The last 7 days, we've had 784. And we are at 147 deaths in Randolph County from coronavirus. Our percent positivity rate, and remember that is the proportion of tests that are positive, stands now at 18%. The goal is 5%. The state is at 14%. So we are higher than the state, but we're both, the state and Randolph County is higher than we need to be. I think we're seeing that across the central part of North Carolina as we are seeing the number of hospital beds fill up in central North Carolina. So we are in a crisis from that standpoint, for sure. We've got 10 long-term care facilities in an outbreak, which means they have more than 2 positive cases in their long-term care facility. And our detention center remains in the outbreak. So now I'm going to turn this part of the presentation over to Tara, and she's going to update you about testing and vaccines. And you know me, I may pop up and say something while she's talking, so I'll let her take over.
I hope she will interject, especially when we get to the vaccine. So just a real quick update on where we are with the COVID-19 diagnostic testing that's happening in the community. It's still happening. We started that back in August and it continues. Right now there are 4 sites that are offering regular testing, and we're still using StarMed Healthcare. They're our partner with that. RCC continues to host their Monday through Friday events at both the Archdale and Asheboro locations. The Archdale location is from 10 to 2 every day, Monday through Friday, and in Asheboro it's 4 to 7. And then the town of Liberty, I still give them props there. They continue to host testing events every Saturday through the month of January. We haven't talked about moving forward yet, but they may be willing to do that. But they are doing that at the First Baptist Church in Liberty every Saturday from 11 a.m. to 3 p.m. And then Pope helped us arrange getting testing at Beulah Baptist Church in Bennett. And they've agreed to do testing every Tuesday through the month of January. And those hours are from 3 to 6 p.m. Well, it seems like a lot of attention is on vaccine right now. It's still important that testing is happening. It's an important tool that people can use to get medical attention quicker. They can isolate quicker and help prevent the spread of the disease. And just a quick number, since we started testing in August, this includes the testing events that we held here at Randolph County Public Health, the community testing events, the RCC. We have tested approximately 4,336 people. So we're pretty impressed by that number. So switching gears to the COVID-19 vaccine, Susan probably mentioned back in November at the Board of Health meeting then that the state was telling us, you guys need to be looking for COVID vaccine to roll out in December. And that's exactly what happened. And just to explain a little bit about how we get vaccine, the federal government allocates to the states how much vaccine they're going to get. So when DHHS receives their allotment, they in turn determine how much counties are going to be allocated. So it's been kind of, in the beginning, we knew it was going to be a limited amount of vaccine, and that's what it is. But they're making their allocations based on population, as well as they're factoring bed size for hospitals. Right now, only local health departments and hospitals are getting the vaccine. We got an email today that the onboarding of providers is beginning as far as getting a process initiated for providers to be able to get the vaccine and administer it. So that's coming. Just an explanation of how much vaccine we've received so far. The first week's allocation that came from the state went to Randolph Health. And they received 975 doses. We received our first round of vaccine the week of Christmas. We received 400 doses of Moderna. The last week of December, we received 975 doses of the Pfizer vaccine. We were actually really surprised that we were received that vaccine, because that's the vaccine that requires the ultra cold storage. And we don't have freezer capacity to do that. We just don't have that kind of freezer storage. So our folks are having to keep that product on dry ice. So they're constantly having to make sure it's got enough. We have to make sure we've got it ordered so that we're keeping that vaccine ultra cold. That's the vaccine that has to be kept -60 to -80 degrees Celsius. Last week, we received 100 doses of Moderna, and this week we anticipate receiving 1,100 doses of Moderna. So you can see with us getting kind of a, we get a high number of doses, and then we get a low number of doses. So it makes it hard to plan, but we're figuring it out as we go. When we started testing, we held a closed point of dispensing, where it was when 1A was the only phase that was eligible. We offered it to Randolph County Public Health staff that are actively involved in administering the vaccine, and to Randolph County Emergency Services. So that gave us an opportunity to do a dry run of sorts before we opened it up to the public, and that was on December 30th. And then we hit the ground running with a drive-through clinic on Thursday, December 31st. And we've held vaccine events every day except for the New Year holiday and then the inclement weather day last Friday. We've upped the number of folks we're getting on the schedule. This week we have 800 people on the schedule to vaccinate. So today through Friday, our goal is to get 800 people vaccinated. Last week, we moved into phase 1B, group 1. So that meant we were offering vaccine to those that were still eligible in phase 1A, but we opened it up to phase 1B group 1 eligible individuals, which are those that are 75 years and older. So we knew we needed to set up an appointment line to take those appointments for that phase. So we did that, and that appointment line went live last Tuesday morning at 10 o'clock. It didn't take long to find out that the phone lines couldn't handle the volume of calls that we were getting. And it took down, the volume of calls took down all of Randolph County government's phone system. So the great IT department that we have with Randolph County, they jumped into action and they found a solution, and we have a new appointment line that went live today that can handle a much higher volume of calls. Just to give you guys an example of how many calls we were getting last week, it was 700 to 800 calls per hour. The new appointment line that went live today, IT gave us some stats that from midnight last night to right around 3 o'clock today, over 7,200 callers called the appointment line. So if that tells you what kind of interest there is. We were able to answer around 450 of those callers. And I think that number is probably a little, well, I don't want to say it's a little low, but at probably before lunchtime today, we filled all of our appointment slots based on the vaccine that we have. So we stopped taking appointments around lunchtime.
Sharon, may I ask a question?
Yes, ma'am.
Go
ahead.
I don't want to break the train of thought. So when you say you stopped taking appointments, I've had people to contact me and say, I was told to go to the CVMS, you know what it is, and that I would hear something, I haven't heard anything yet, or I've been told, you know, my name's on the list, but I don't get a call. And so what about all these calls that continue to come in? What kind of messaging are they getting? And for these people that are waiting, what I have said is we won't schedule appointments unless we know that we have that vaccine coming in. Vaccine's coming, we just don't know how much. So assure them that they will be called if their name is on that list. Okay.
Did you all hear the questions that Hope had? Okay. So to answer the first question about the CVMS system, that's the COVID vaccine management system. Everybody that receives the vaccine has to be entered into the CVMS system. And some of the phase 1A folks, we prompted them to go ahead and do that registration process to expedite the process. So when they sent us information on folks in their provider offices, like there were group homes that were interested in the vaccine because that's considered congregate living, like a long-term care facility, or a provider's office that might deal with COVID patients. They would send us names, contact information for the folks in their office that were interested in the vaccine, and we would upload their names and contact information into CVMS. CVMS then in turn would send them an email prompting them to register in CVMS. And when they registered, that just finished filling out their demographic information and asked them a few health related questions. And then once they finished that, they were sent another email from CVMS, which is a state maintained system, I will say that, prompting them to schedule an appointment. And as soon as we knew that the information was uploaded into CVMS, we would send a follow-up email saying, you've been uploaded, you need to contact our office to schedule an appointment, and the how to schedule, the phone number and all of that was provided. So does that answer?
Yeah.
That part.
Yeah.
Okay. So to answer the question about getting the other appointment scheduled, I failed to mention with all of the phone calls we got last week, we probably talked to 1,200 people after the phone line went down. And we were trying to figure out how to best manage that. So we were taking people's names and numbers, and we told them that somebody would call them back to schedule an appointment. So when we looked at that late last week, we had like 900 people we had to call back, and we still have to call back a good number of those. So for those folks who got through to us last week, left a name and number, they're going to hear back from somebody from our office as soon as we can get to it. It just takes some time. We were asking some of our folks today, how many folks were you able to reach today? And it varied. I think the person that I talked to that did the most was able to schedule 35 appointments. So when we knew we had so many people to call back, we went ahead and set aside that many slots in our appointment making so that those folks that got through last week would get appointments for vaccine. So today when we opened our appointment line, we knew we only had so many slots left based on the amount of vaccine that we have. Does that make sense to everybody?
Wait, so are you, okay. So are you saying that if somebody left their name and number last week, they will be scheduled for an appointment? You held vaccine for them.
We held appointments open.
So even though they may not have heard back from you yet,
we're working on it.
you're working.
Yeah.
Okay, I just want to get that straight for people that call me, because
Sure.
I don't want them calling public health and coming down here and.
Well, they're calling us and that's fine, but
Yeah.
we're reassuring folks that
Okay.
they're going to hear from somebody.
Okay, all right, good.
So we've shifted gears on how we're no longer taking names and numbers. We're no longer accepting walk-ups. So last week we had people coming down here because they could not get through on the appointment line, and we would take their information. But to get out of the hole that we're in, as far as having 900 people to call back, we're not taking any contact information over the phone or in person, and appointments are only scheduled through the appointment line. That will help keep us on track for getting appointments scheduled appropriately. Since we started administering vaccinations for the COVID vaccine, counting today, we've done 576 vaccines. So that's good. And that number is going to grow this week. Like we've got 600 more to do this week. And lastly, I just want to quickly mention that we are currently in the early processes of working on a collaboration with Randolph Health regarding COVID-19 vaccine. Nothing's been finalized, so that's pretty much it. Question about vaccine or anything that you want to add?
Okay, so of course I have one. I'm sorry, I'm asking the questions I know other people ask, and even though these are healthcare professionals, if they don't do vaccines, then they may have these questions too, and I want everybody on this board to be able to talk to citizens about this. There are two registries, the CVMS registry and then the immunization registry. Do other providers have to put names into both, put information into both registries, or just public health?
You want me to answer that? So CVMS is a federal registry that every state has to use. And we are obligated to use that so that the state can see who's using vaccine. It helps us keep up with our inventory. So that is a database that we have to use. The only other database, there is an immunization registry. That's a North Carolina database that keeps up with immunizations for adults and children. We are not putting, these vaccines are not going in the immunization registry,
Okay.
only in the COVID vaccine management system, CVMS. The other database is our electronic health record. And that is our way of keeping, scheduling appointments and keeping up with the folks that we see. So we are working out of two electronic databases, but one is the COVID vaccine management system, and one is our electronic health record.
So any provider that administers COVID vaccines will use the CVMS register.
Yes,
Okay.
ma'am. They'll
Okay.
have to.
Okay.
I
I
got
have
a
a question.
Go ahead.
Can you give us that telephone number again? I think I saw it somewhere in the email for the appointment line. And then also just trying to find out where the veterinarian fits in the 1B2 class
I sent that up.
for the vaccine.
So to answer your first question, the new appointment line, that number is 336.
365-6110.
Did y'all get that?
Yes.
And to answer your question, Carrie, Susan has sent the question to the state about the veterinarian, where you guys fit in the phases. So
No answer.
we've not received a response. And
Well, from the veterinary medical board, I have heard that food animal is considered under essential and government, but we were classified that as a small animal as well. So they are being classified under 1B, but I had rumored that small animal would fall under phase 2. So I just wondered if you had any clarification on that, because we have 4 doctors that can't get it fast enough.
I understand. And you actually know more about it than we do in terms of, the phases. Because they've not answered me. I've asked, where do veterinarians fall under, private practice vets? Where do they fall under the phases? And nobody ever answered my question. I can put that back up. There's a call that we sit in on every morning at 7:30, and I'll bring that back up to them again.
And I was just double checking, there's a newer version of the deeper dive phase 1B that came out January 6th. I was just double checking to make sure it didn't clarify and it didn't add veterinarians or veterinary staff.
And I know the state of Virginia is vaccinating all veterinarians and veterinary staff. So that's why I'm assuming state can be different than federal.
They can, and honestly, I didn't know that until about 2 or 3 weeks ago. North Carolina, what the states do is they've taken that those recommendations from CDC, and then they've interpreted it based on what they feel like is appropriate for their state. So NCDHHS are the ones who have determined where we start with the phases. And then they've broken those down into groups. So you're right, it can vary from state to state. Now, I will tell you, we're seeing a lot of people, we've had people from Michigan call us for vaccine. And I was on looking at my email this afternoon, and there are a ton of people that are coming from other states to North Carolina to get their vaccine. And I'm assuming because it's federal vaccine, there's really not that restriction that applies. Same thing from county to county. Some of the folks we had call us last week don't even live in Randolph County. But we've been told that anybody that requests vaccine, it should be made available to them.
Okay.
My point is, Carrie, I guess you could go to Virginia and they wouldn't turn you away.
Okay.
My
But
question.
you said, go ahead.
Go ahead. Go, Carrie.
You just said if someone is requesting and Randolph County is not turning them away, or?
Yeah, I mean, when we signed the agreement to take vaccine, that's part of it. And we're going to provide vaccine because it's federal vaccine allocated to each state. So
Okay.
my point is, if I live in South Carolina and I want to go to Charlotte to get my vaccine, they're not going to tell them no.
Okay.
As long as they're in the group that's being.
Right, as long as they're in the group that vaccines being allocated to at that point in time, but not based on their residency. We wouldn't turn them away. North
Okay.
Carolina wouldn't turn them away.
My question, when they need to get their second vaccine, is that automatically coming to you? Or do you have to allocate what you have gotten so that the people can get their second vaccine in addition to those who are getting their first vaccine?
So the second doses are being held back. We don't have them yet. They will be sent to us around the time that they're scheduled to get them.
So they will automatically send them to you?
That's our understanding.
Okay.
So my question is, when they're scheduled for their first vaccine and they come get it, are they then scheduled for their second vaccine?
They are.
Automatic.
They are.
Okay. And then I have another question. Our church sent out last week to come up there to get the appointment, and some people did, and some people are still waiting on phone calls from church because they had left their message last week. So do I need to ask the church possibly to put out a message, because they sent it to the whole church, a message to not come up to the health department to try to get in line to make an appointment?
That would be helpful, because if they come up here, we're gonna say you need to call the appointment line.
And I know a couple that did today. If they call the appointment line, will they automatically get an appointment versus waiting on the phone call from leaving their name last week?
So the way it's set up now, when we answer the appointment line and we don't have any appointments to schedule, we're asking folks to call back and check back starting next Tuesday, the 19th, because we're closed for the Martin Luther King Jr. holiday on Monday. But we're also encouraging people to check out our Randolph County Public Health Facebook page, the Randolph County Public Health website. There's a vaccination tab on our COVID Randolph County Public Health page, and then the county's main website. They're keeping that updated as well. And we also encourage people, if you want to, feel free to reach out to our hotline where you can ask questions. The hotline's going to know the latest on the vaccine availability. And again, that hotline number is 336-318-6227.
But if they left their name on the list last week, just their name, they didn't get an appointment, they need to sit tight for right now.
Yes, ma'am. Yeah,
Okay.
Tim, we're working really hard, but there's just so many to call back. It's taking us some time to get it done.
And then my last question is there anything the Board of Health can help y'all do?
I think we're good. I mean, if you guys are interested, I will invite you down. Hope stopped by the other day, but if you guys are interested in seeing how our drive-through clinic is set up, if you want to see how that runs, you're welcome to pop by and see how it's going. We get lots of compliments. People are flowing through very quickly. It's a very smooth process. And I will give a shout out to Mary Ann Evans. She and Ashley Duggins are volunteering some of their time to come down here during our clinics to answer questions that folks might have while they're getting their vaccine. So thank you, Mary Ann and Ashley Duggins, if you're watching.
Okay, so I'm sorry you turn around my what now? I know. I'm not the healthcare person in the room, so I have the questions that ordinary people ask. Before I ask the question, I'd like to say that I have gotten text from 3 different people since I've been sitting here. 2 of them, one is another commissioner who had somebody contact him about where they could get a test today. He contacted me because he was not sure, but I told him about the clinics that we have. Person texted him this: tell them their COVID testing site is quick and easy and everyone is really nice and helpful. Took me 8 minutes total waiting and getting swabbed. But no, I had told him to go to do the text and register ahead of time. I had another lady that I talked to. She said it took her 35 minutes. I will say that when I came into the Board of Education for my meeting at 4:30, The line at RCC for testing wrapped around and way back there. So there is a demand for testing, which encourages me that people are, they're more on top of it, paying attention to it. And so I'm really, really thankful that we have all the testing sites that we do.
And you saying that, I'll just point out, it looks like Mondays are a busy day for testing.
Sure, on the weekend.
So for the last couple of Mondays that the sites have been open, the counts are higher those days.
Okay. All right, and then one other question. If it is raining, since these are being given outside, will they be able to continue on schedule? Vaccines, yes, vaccine.
Yeah.
Okay, good.
As long as we don't have some adverse weather, snow and ice.
Okay.
I don't know, did you drive around back today?
I did, but I did the other day. You could have changed something.
I don't know what was set up, but we've gotten tents that have sides on them.
Okay, excellent. Okay, good for the workers.
Yeah, for the
Okay,
workers,
good.
but the cars can drive right into those tents. Can you guys hear what I'm saying? I'm sorry, I'll turn my back.
Okay. Okay, all right. I am. I'm trying to think about things that people may not know. But let me go back. You said that 900 names were left last week. And the one person that you talked to today had scheduled 35. So that just tells me that it is very slow process getting all this data and getting it in and getting that appointment scheduled.
It is, because when we call somebody, like I said, Susan probably may have said part of it, their information is entered into the CVMS system, and then it's entered into our electronic health record to schedule the appointment. Now, mind you, some of those calls, I didn't clarify with this person. There may have been more than one person in that household.
Sure.
Because a lot of times we would get one name, and then we'd call them, and they would be, well, I want to add my spouse.
One person that tested me added two other, that had added two other
So that
people
clearly,
because of their age.
yes, and that clearly slows down that process.
Yes.
Anybody else?
Susan, do you have anything else? Okay, board members, any other comments or questions for Tara or Susan before we call for a motion to adjourn?
Wait, could I say one more thing? I'm sorry. If, I don't know how many of you do social media, but if you'll look at my Facebook page, I posted an article that was online, and let's see if I've still got it pulled up in here. In that article, they talked to them at Cone, and they were talking about their projections for how many their beds were all going to be full. And right here it is, Greensboro's on the White House surge list. And of course, it won't come up in here, but if you look at that article that I posted, it talks about what was really striking to me was they will be at capacity pretty soon, and then beyond capacity by the end of the month, and way in the hole with projections they're looking at going into May. And so that's not just there, that's, that has to be everywhere. So you may want to read that so that you could talk to your friends and neighbors and colleagues and citizens that come in and out and help them to understand what we're facing. I had somebody who's on a task force for DHHS to tell me about 3 weeks how it is going to get very grim. So I knew that he knew stuff I did not know when he made that statement. That's all I'm gonna say. I'm sorry. I promise.
Okay, anybody else? Okay, our next meeting, guys, mark your calendars, will be on Monday, March the 8th, at 6 p.m. So if there's no further business, I'll call for a motion to adjourn the meeting.
I, Robert Brown, move to adjourn the meeting.
Motion, may I hear a second?
Alan
I,
Ferguson.
Carrie Hampton.
All right, so we got a motion from Robert and a second from Alan, so I'll go through the roll. I'll call your first name, state your first and last name, and aye or nay. Robert?
Robert Brown, aye.
Looks like Mary Ann had to jump off. She had another meeting coming up at 7. Alan?
Alan Ferguson, aye.
Carrie?
Carrie Hampton, I.
Hope?
Okay, would,
Julie?
Julie May, aye.
Ryan?
Brian Snipes, aye.
Max?
Max Semi, aye.
Amy?
Amy Williams, aye.
Marty Trotter? Aye. So guys, the meeting is adjourned. Thank you. We'll see you on March the 8th.
Thank you. Be safe.